Hi, you're listening to the Baby Manual podcast, the podcast that helps you feel confident as a new parent. I'm your host, a pediatrician and mom, and the author of the Baby Manual, Dr. Carole Keim. Hello, and welcome to this week's episode of the Baby Manual podcast. This is episode number 6, when your baby is 4 months old. So parents, this is one of my favorite ages. It's when your baby is starting to be so much more fun. They start smiling, they laugh sometimes, they do those happy feet where you just give them a big smile and they start kicking like they're really happy. It's the cutest. So I really love the 4-month visit. Also, most parents are starting to feel more confident at this age. You're starting to notice patterns with your baby, and you might also notice that every time you find a pattern, it changes again, and that's pretty typical at this age too. But this is when you're really starting to fall in love with your baby because they're starting to show parts of their personality and really interact back with you. They're not just, before now, they've been mostly just eating, sleeping, peeing, pooping, and crying, and now they're starting to really feel like little people. It's so cute. Parents, moms, especially with long hair, you might start noticing that you need to start wearing your hair up because at this age, babies will start to reach for stuff and latch onto it with their little hands. And those are some really strong hands. You might also not want to wear earrings or necklaces at this age too, because they can really grab onto that and it can hurt sometimes. For their development, babies are starting to be able to console themselves at this age. So you might notice your baby doing things like sucking on their hands or a pacifier, or even just like noticing their hands and playing with them to keep themselves interested. It's pretty fascinating. They start babbling and they'll start with just vowel sounds at first. So this age, it's mostly vowel sound babbling, not a lot of the consonants yet. So they shouldn't really be saying things like mama or dada yet. It's mostly just like ah, and sort of cooing with inflection, which is cool. You can try having little conversations with your baby back and forth, and that can help boost their development at this age. You might notice they have different types of crying now too. So they're going to cry differently when they're sad, when they're mad, or when they need something. They can also start to show signs when they're happy or sad and not just needing things. So that's pretty cool. They'll also respond to affection at this age. So you'll notice that when you give them kisses, they'll smile. It's really sweet. They should be lifting their chest when they're doing tummy time. So around 4 months is where they can start rolling. And typically they start rolling from front to back because when we're doing tummy time, they're pushing their chest up off the floor and then their head's kind of heavy. And so sometimes that'll just like topple over and cause them to roll the rest of the way. They might even start like fully trying to roll at this age where they're really throwing their body weight into it and flipping themselves over. That brings us into the safe sleep stuff. Because they are starting to roll at this age, you have to be extra careful not to have any blankets or pillows in the bed with them or any toys, no crib bumpers, no mesh screens on the crib, nothing like that, because those can all be very dangerous at this age. Sleep is really variable around 4 months. Some babies are sleeping really well suddenly at this point. Some are sleeping really poorly. Some are having a sleep regression at this age. It's all across the board. My best advice there is just that it will get better over time and just keep doing what you're doing. This is the age where they're starting to notice patterns. So you can start having a sleep routine where you wind them down. Maybe something like, you feed them their last bottle or breastfeeding session before bedtime, then brush their teeth or their gums with just plain water, and a soft toothbrush or even a silicone toothbrush is fine. Those finger toothbrushes, I don't necessarily recommend those because babies will bite and it hurts. So just a regular soft toothbrush is fine. And then you can read them a book or sing them a lullaby, tell them a story, or things like, to help them sort of wind down, signal that it's bedtime, dim the lights, and then ideally set them down when they're still awake but starting to be drowsy. That's really tricky to do. So even if they're just very lightly starting to sleep, you can set them down then too. Things that I don't necessarily recommend, but could help with the sleep routine, it's really just if your baby needs it. And if they're difficult to get to sleep, you can try things like blackout blinds, which help keep the room really dark. You can try a white noise machine, which is something that just helps if they tend to startle easily, or if you live in a noisy area, like with a lot of traffic outside, sometimes a white noise machine can help. And sometimes you can have music playing as they're falling asleep, like soft lullaby music. But those are things that babies at this age, like I said, they're noticing patterns. And so they can become dependent on that. And it can be harder to get them to sleep without it. So if you're planning to like travel in the future, for example. This is something I might caution against, unless they really need it, because it can make it harder for them to sleep in other places in the future. As far as safe sleep at this age, so we talked about alone on their back and in a crib, but where should the crib be? So the current recommendation by the Academy of Pediatrics is to have the crib in the parent's room until the baby is 1 year old. Now, this recommendation is not actually based on any specific evidence or studies. It's really just based on what we think is best standard of practice to help prevent SIDS or sudden infant death syndrome. They are starting to do studies where they're showing that babies that are moved out of the parent's room and into their own room in a crib at 4 months of age will actually sleep better by 9 months, and they will continue to sleep better even at the 2 and 3 year visits. So there is evidence showing that they'll sleep well on their own. They'll be able to self-soothe a little easier and get themselves to sleep a little bit better if you have them in their own room starting at 4 months, but that's not a recommendation yet officially by Academy of Pediatrics. So officially we tell parents keep them, in a crib in your room until a year. No blankets until they're 1 and no pillows until they're 2, because there's that very high risk of them rolling and suffocating during that. As far as eating goes, so at this age, they're still primarily eating breast milk or formula. And in many countries around the world, they should only still be eating breast milk or formula. But I see that some parents around 4 months start to try solids. So I want to talk about that a little bit. First, real quick about the formula or breast milk volume. It should be about 24 to 30 ounces per 24-hour cycle. And they're starting to consolidate their feeds more and more. So it's about 4 to 6 times that they'll eat. And they'll eat about 4 to 6 ounces each time over the 24 hours. And a lot of times it's during the day that they're eating and sleeping a little bit better at night, but again, not always. So signs that they're ready to start solid foods. They start showing interest, which is just so cute. They'll like open their eyes real big and open their mouths and kind of reach for it and pant like, because they're just so excited to see that food. They'll watch the food go from your plate into your mouth and back. So then this is when parents are like, okay, maybe we should start feeding them a little bit. Other signs that they're ready are that they're able to hold their head up when they're seated with support, which means if you have them sitting in a high chair, their head stays upright. It doesn't tilt to the side or the front, because those are risks of them choking if their head is tilting to the side like that. And then the last sign is something called the extrusion reflex that we can test for in the office, but you can actually do it at home. So the extrusion reflex is when, with little babies, if you put something into their mouth, they will use their tongue to push it back out. So it'll look like this, like kind of sticking out as you're trying to feed them with a spoon. So you can test with an empty baby spoon, and try to just put it into their mouth gently and see if they stick their tongue out. If they don't, if they suck that spoon in and suck on it, that's a sign they're ready to start solids. So how to start? And I'm going to talk about baby-led weaning in a second, but the traditional way is with purees. And we used to always recommend starting with rice cereal or oat cereal. Now, we don't necessarily recommend those anymore because they're just empty calories. But one thing I do like about them is that with a rice cereal or an oat cereal, you're mixing it with either breast milk or formula. So it's really just becoming a texture thing for them and not so much of a flavor thing. They don't have a whole lot of flavor. So if your baby is eating and spitting food out, if you're giving them something like rice or oat cereal, you'll know it's just because of the texture that they're struggling. Whereas if you're giving them, say, peas or green beans, maybe just they didn't like that one. So that's kind of the one reason I recommend rice or oat cereal is as a training food. But once they've got the hang of swallowing, they really don't need it anymore. And in my experience, it seems like rice cereal tends to be the best tolerated in babies. I know there was some warning about arsenic in rice, and honestly, the amount that they're eating is not enough to be worrisome. And also, rice cereal is made out of white rice, and the arsenic concerns more in brown rice, which is because it's in the husk of it. So anyway, rice cereal should be totally safe for your baby, and it is fortified with nutrients too. With oat cereal, I tend to see more babies that have things like eczema or vomiting after oat cereal. I don't know why. Sort of an unusual, because oats are not supposed to be very allergenic, but that's just my experience over the last several years in the office is I see that the oats are not as well tolerated. If you don't want to do cereals at all, that's great. You can just skip right into the good stuff. The official recommendations now with the Academy of Pediatrics as of 2022 are that it does not matter what foods you give to your baby or when you give them, as long as you're avoiding milk, like straight up cow's milk, but dairy products are okay, and honey. Now with honey, you can't have honey in anything, even like Honey Nut Cheerios or honey graham crackers or honey baked ham or honey mustard. Anything with honey in it, it doesn't cook out the bacteria that can cause botulism. There's a spore that it produces. So that's heat stable. So even if foods with honey have been cooked, it's still not safe for babies less than a year to eat those. And then with cow's milk, it's just if you're giving them cups or bottles of milk, they fill up on it. It's not terribly nutritious and they can cause other nutritional deficiencies. So those are the two foods they can't have, but anything else they can have, and they can have it in any order. So like you can start with eggs if you want, or liver, or whatever you want. You just want to make sure your baby's able to eat and swallow it. So with baby-led weaning, what you're doing is you're handing them bits of adult food, or you're mushing up your food and giving them bites of it. And that is okay to do. Or with the traditional way, you start with the purees and then you go to the chunkier ones and then you go to the full-on solids. And a lot of families will do a mix of both, and that's totally fine too. So the progression that I like to do is green stuff first, which is things like, peas, spinach, broccoli, all of the green vegetables. They're very nutrient dense and they're not very sweet. Then the orange vegetables, they're a little bit sweeter. So that's things like carrots and sweet potatoes and squash. Those are, pumpkin. Those are a little bit sweeter of vegetables, and babies tend to like them a little bit more. And then fruits at the end. So fruits are the very sweetest, and things like apples and bananas. A lot of parents will start with those, and then they're like, but my baby only likes those. And I know that officially evidence-wise that they say that that's not the case, but I've seen quite a lot of babies that become picky early on because they're starting with the really sweet stuff. When you're starting these new foods, you only want to do one new ingredient every 3 to 4 days. And that's whether you're doing baby-led weaning or the puree method, because if they do get a food allergy, and signs of food allergy are a rash or vomiting, then you don't know which food it was to if you're giving them multiple foods at a time, or if you're giving them something that has multiple ingredients in it, like with the baby-led style. With the food allergy, with the rash, what you'll notice first is probably spots on their face or their trunk. So you may even want to start, when you first start feeding a new food, do it with their shirt off. They're messy anyway, right? And then you can see if they're going to get a rash on their chest. With the vomiting, if they do start vomiting from a food allergy, it's profuse vomiting. It's not like a one-time spit up kind of a deal that you're not really sure if it was the food or not. They're vomiting usually multiple times in a row, and maybe even like dry heaving when their stomach is empty. So it's pretty apparent when they're allergic to something. If that does happen, if they are vomiting or they get a rash with a food, stop that food, write it down, and you can consider trying it after a year of age, but talk to your pediatrician first before you reintroduce that food. With the allergen foods, there's talk now about introducing sooner rather than later. So peanut allergens are something that they've studied really extensively with this to try to figure out, when do we introduce this? Because peanut allergies are so severe, they're lifelong. It'd be amazing if we could prevent it, right? So they do studies on babies that are at very high risk of peanut allergies. And those are babies with a strong family history and also who have severe eczema. And they found that with these babies, they actually do better and they're less likely to get a peanut allergy if they introduce peanuts around 4 months of age versus waiting until after 6 months of age. So the way that you introduce peanuts to your baby is with just a tiny bit of peanut butter. You can dip your pinky into it and then just put that in their mouth and let them suck it off. Just the tiniest little bit. You can do that a couple of times, and that can be one of their foods that you're introducing is peanuts. You'll know pretty quickly whether or not they're allergic to it. And if they are, you need to stop immediately. Peanuts don't tend to cross-react with other nuts. So it is okay to try other things too, like almond butter and things, to see if your baby reacts to those. Now, if you personally are allergic to nuts or peanuts, your baby's at higher risk of having an allergy, but not necessarily to the same thing. So it's okay to give your baby those foods, but just be careful to take care of yourself so that you're not having an allergic reaction while you're feeding your baby. Also, keep in mind that babies who are breastfed are getting all of the proteins that mom is eating. And so that's also protective against allergies because they're getting, presumably if mom's eating peanuts, they're getting peanut allergens, from birth. It's a lot less likely that breastfed babies are going to have reactions to foods, but they might still. So definitely keep an eye out for signs of allergy. Now, for starting water, you can actually start water when you start food. Babies' kidneys aren't really working that well until they're about 6 months old, so be very careful with the water at this age. When you're giving a solid food, like a puree, say you give 2 ounces, you can offer 2 ounces of water with that. So a 1-to-1 ratio of offering water to food, but don't expect them to drink all of it. They probably won't, but it's okay if they drink up to that same amount of volume. So with baby-led weaning, it can be a little harder sometimes you're blending up your own baby foods and that's great and giving it to them, but sometimes it's kind of hard to gauge. So you can just, try to see like how big is that thing of food? How much do they actually eat of it? And just a tiny bit of water with that. With baby-led weaning, the idea is that they're getting to choose what they put into their own mouth versus purees. You're using a spoon to put the food into their mouth. So there's some thought that with babies who grow up with baby-led weaning, they should be better eaters later on because they're used to feeding themselves and choosing what to eat. And there's thought that they might be less picky, but honestly, I've not seen research yet to show that. So any sort of way of feeding your baby is fine. Try to offer them a big variety of foods. And also, they say that food before one is for fun, which means it's mostly for training purposes and not primarily for nutrition purposes. Of course, they are getting nutrition out of their food, and it's really just like a supplement to them at this point. So they're mostly eating that breast milk or formula still with a little bit of food here and there. When you're starting the solids, you can start with one food once a day is plenty. You could try twice a day or 3 times if it's convenient, but really just breastfeed them and then offer the solids after, or you could offer solids first and then top them up with breast milk or formula. Those are 2 options of how to do it, but it's not really a prescriptive way of doing it. Like you don't have to necessarily offer an exact amount and then increase that amount by a certain amount each week. It's really just following your baby's cues and letting them try out the different foods, and do expect them to make a big mess with it and smear it around. And that's totally okay. That's all part of learning to try new foods. For peeing and pooping at this age, they're starting to have more regular patterns. When they're still eating entirely breast milk or formula, that rule of 7 still applies. So anything from once a week up to 7 times per day of poop is considered normal. But once they start eating solid foods, they should be pooping about 1 to 3 times per day. So if your baby's pooping less than that, or if they're constipated, they probably need a little bit more water. And if a little bit of extra water, and I'm talking like an ounce or 2 extra in the day, not whole bottles of water. If that's not enough to help out, you should talk to your doctor because they could have a food allergy and that can cause constipation too. They should be peeing about 6 times per 24 hours at this age. Now for skincare stuff, oh my gosh, they're so cute at 4 months. They're starting to get those chubby little skin folds, and their legs, you might notice they have rolls on their legs or on their arms. They probably have rolls in their neck or no neck, it looks like at this age, because they're just so chubby. It's so cute. The thing with those skin folds is that they do get a little sweaty in there, and sometimes they get a little bit of milk in there, and it can get kind of smelly. So you're going to be wanting to wipe those skin folds a couple of times a day, like each time that they eat, or the folds on their legs. You want to do those with, like a wipe when you're changing their diaper a couple of times a day, or at least just looking in there to make sure it's not getting pink inside. If you do notice a rash starting to come up, you can use regular diaper cream in the diaper area, but also in their neck folds or leg folds, because it's the same kind of process that causes a rash there as in the diaper area. It's wet and it's skin rubbing together, and the skin gets a little bit broken down. And then sometimes it even gets a little bit infected with candida, which is a yeast that lives on the skin. So if the regular diaper cream isn't enough to keep those folds clean or to get rid of that drool rash that's on their chin or in their neck, then you can try something antifungal for that. The yeast infections that they get in those areas, it causes the fold itself, or like the main area of rash, to be this bright pinkish color in babies with pale skin. In babies with darker skin, sometimes they can even be depigmented, but sometimes it's a darker color. And then you'll notice these tiny little pinpoint dots around the edges of it coming off of it. And those are called satellite lesions. And those are a clear sign of a yeast infection. So over-the-counter antifungal creams can sometimes help. Things like ringworm cream or jock itch cream or athlete's foot cream. Those are all names for the same stuff. If you don't want to use those, you can try something a little more natural, like a 1-to-1 mixture of apple cider vinegar with water. Vinegar is antifungal and can help to treat that rash. Or last case scenario is you can talk to your doctor and they can give you a prescription for a cream called nystatin. And nystatin is an antifungal cream specific for Candida and is really effective at this sort of a thing. Now, with the rest of their body skin, you can use things like lotion or cream or ointment after baths if they need it. This age, eczema tends to be a little bit clearer defined, so you'll see it more in patches, like in their elbow, the inside of their elbow, behind the knees, sometimes on their cheeks. Sometimes it's actually the back of their arms and legs because that's where their body's rubbing when they're wiggling around. But anyway, patches of dry skin or patches of eczema, you want to start off treating that with something thick and greasy like Aquaphor, Vaseline. Something petroleum-based is really good. That's not quite enough. You can consider going to hydrocortisone cream, but talk to your doctor before doing that because that's a steroid. It does get absorbed into your baby's body and it can have side effects. So if you're thinking of, if you think your baby has eczema and it's pretty bad and it's not responding to just the moisturizing ointments that you're using, talk to your doctor, see if they need to do some kind of a steroid on that. Now, sunscreen and bug repellent I get asked about a lot at this age because they say on them you can't use them until they're 6 months old. And really the reason for that, so with sunscreen, it's just not fully protective like it is for an adult in babies. Babies don't have enough melanin in their skin, which is that thing that causes skin pigment, until they're about 6 months old. So babies less than 6 months, you can put, it is still very safe and you should still put sunscreen on them, but just keep in mind that you can't sunscreen them up and then sit them in the sun. They still need to be in the shade. They still need to be covered up with clothing so that they're not getting any direct sunlight on them. And the sunscreen will help with that passive sunlight that gets reflected off of other surfaces. So it is okay to use sunscreen with them. Just keep in mind it's not fully protective. With insect repellent, I like to recommend citronella over things like DEET because DEET is pretty poisonous and not great for children. But citronella is a natural alternative. It's really effective. Babies can't eat it, so just be careful that you're not putting it on their hands or their feet that they might be sticking those in their mouth. But under areas of clothing are safe areas to put citronella, or you can even put it sometimes you can get sprays. You can spritz down their stroller that they're in, or you can also get things like mosquito nets to put over them that can help them as well. All right, so now let's talk about teeth real quick. So once their teeth are coming out, and teeth can come out anytime in the first year. So a lot of 4-month-olds are starting to show signs of teething. The average age of the first tooth is 6 months, but again, can happen anytime in that first year. So you'll notice that your baby might be drooling a bit. They might be fussy, and they might have some low-grade fever, and those are signs of teething. Sometimes some babies don't drool so much, but they swallow that extra saliva. And when they swallow it, it just turns into slime in their intestines, and they end up with these soft, slimy stools, sort of like diarrhea. So if you notice your baby's having some softer stools and fussy and chewing on stuff, that can also be a sign of teething. But typically the first teeth that come in are the incisors, the central incisors, which are those 2 front teeth on the bottom and on the top. So usually it's the bottom ones and then the top ones. Could be in any order, and it's totally okay if your baby gets teeth in the different order than the usual progression. Once those teeth are out, you do want to brush them twice a day with plain water. And as they're starting to come out, as they're teething and you're seeing little tooth buds in there, little swellings on the gums, you can start brushing already at that point, and it can feel pretty good to them to have that kind of pressure on their gums. Also, things like teething toys are great. I love all the silicone ones. There's different shapes, different textures of them. So just make sure that it's safe for babies, the one that you have. But yeah, I would get a variety of different teething toys for them at this age because sometimes they'll like one for a little bit and then like a different one. Also, things like frozen washcloths. You can just take a clean washcloth, make sure it's rinsed out. It doesn't have any softener in it or anything. And just soak it with water, put that in the freezer, and then they can suck on that. And that can feel really good. Also, they make these little mesh bags that kind of look like pacifiers. And there's also silicone versions of that. And I like the silicone ones a little better because they're easier to clean. But those things, you can put frozen fruit inside of them, or you can put frozen breast milk or formula, like that you've frozen in an ice cube tray, inside one of those things. And then they can chew on that. And, as it melts, they get a little bit of nutrition with it. But also it can feel really good on their gums. And then medicines for teething. Tylenol is the number one at this age. Babies are not supposed to have ibuprofen until they are 6 months old. So they can have Tylenol, also called acetaminophen or paracetamol if you're outside the US. And make sure you ask your doctor for your dose because it's dosed based on their weight. And you can also try some topical teething things like Oragel or Anbesol, which are just 2 over-the-counter versions of something like lidocaine. It's like benzocaine, and you can put that on their gums. The thing with those, it lasts for like an hour or 2. So those can be really good before they're eating. Like if their teeth are bothering them and they're not wanting to eat very much, you can do something topical like that Oragel, and that'll help them to eat a little bit better. But there is a limit on how much of that they can have, and it's not great if they swallow too much of it. It can cause even heart problems. So tiny bit here and there, only if they really need it. And then for sleep at night, something like Tylenol will be better for that. There are some other alternative preparations, things like clove oil and homeopathics that I know that some of my patients have used. Those aren't FDA regulated, and officially I cannot recommend those. And I know there was a recall recently on some of those homeopathic tablets that a couple babies died from them. But I know that they're back on the shelves again and, being quality controlled. So it's one of those, like, it might help, it might not help, it could potentially be dangerous. So officially what I recommend is things like the cold foods will help, the frozen washcloths or like the frozen fruit in a bag kind of things, and the paracetamol or acetaminophen or Tylenol, and the topical teething ointments. Now, as for their 4-month checkup, and this is the last bit here, babies should have gained about 2 or 3 pounds since their last checkup, and they should be about twice of their birth weight at 4 months. So they say that babies should double their birth weight around 4 months of age and triple it around a year. So they're going to start growing more slowly at this, half as slow basically for the next 8 months. Yeah, they should be about twice birth weight, and that's based on a 7-pound average baby. So around 14 pounds, but if you had a bigger or smaller baby, it's not exact. So don't be worried if it's not exactly twice their birth weight. They're going to get their second round of vaccines at the 4-month visit. And it's the same vaccines that they got at the 2-month visit, except for the hepatitis B. The Hep B is on a sort of a funny schedule. We give it at 0, 2, and 6 months of age, whereas all the other primary series we do at 2, 4, and 6 months of age. So we're just skipping Hep B at this visit. But it's going to be 2 shots, usually 1 combo vaccine that has DTaP, polio, and Hib in it. And then a second shot, which is the PCV or pneumococcal vaccine that has 13 kinds of strep in it. And it's the kind of strep that goes into your bloodstream and causes things like sepsis, pneumonia, and meningitis. And then they'll get their second dose of the rotavirus vaccine, which is an oral vaccine. And that one is just the syrup that they drink. They should have about the same side effects as the last time, as their 2-month visit, sometimes a little bit stronger. So if they got a swollen leg at their 2-month shots, they're probably going to have a little more swelling this time, and it's probably going to last a little bit longer. If they had a little bit of low-grade fever with their first round of shots, they'll sometimes also get that low-grade fever with this round of shots, because now they're being re-exposed to the same stuff that they've already reacted to. So usually they react a little bit quicker and a little bit stronger, but then it also goes away again. So if you're worried about any vaccine reactions, call your doctor. Things that are not normal, if they break out in a body rash after their shots, that is not normal. Take a picture and talk to your doctor about it. And if they start vomiting after vaccines, that is not normal. So just like with foods, vomiting and rash are signs of an allergy and need to be brought up to your doctor's attention if that happens. For development at this age, so things that you can help with their development are tummy time, twice a day, 30 minutes. And really, we want them to be pushing up and rolling themselves out of tummy time. So you can inspire that with using toys and just kind of place them out of reach so that they kind of roll and reach for them and try to get them. You should also anticipate that they're going to be rolling on their own. And so you got to be extra careful about not leaving them on high surfaces at this age. And I just have to reiterate, no blankets in the crib. I had a patient who was 4 months old who passed away because they were sleeping with a blanket in the crib. Parents went to check on them because their nap was going a little longer than expected. And baby had rolled for the first time ever and had the blanket wrapped around their head and didn't survive. So this does happen. It's scary to think about, but I really have to reiterate that one. It does happen. They should be in a rear-facing car seat until they are 2 years old or until they outgrow the car seat. So later than 2 would be even better. They should be babbling at this age, and you can practice taking turns talking with them, as I said earlier, and that can help, to boost their development. Try copycatting what they're saying, and they'll copycat what you're saying. And also they like to copy facial expressions. And so it's really fun to make different faces at them at this age. You can also try things like blowing raspberries, like kind of thing, or kind of sounds, or even rolling R's, like some babies will try to copy those kind of things too. It's really fun to see. The babies should not be sitting on their own yet or crawling at this age. I get a lot of parents asking at this age, like, well, I can sit them in a thing, but if I sit them on their own, they just topple over. And that's normal until 9 months. And the same with crawling. They will be rolling, and they might even roll themselves across the floor. Like they can log roll all the way across a room, but they're usually not crawling until they're about 9 months old too. So it's okay that they're not doing those things yet, but those will be coming up soon. So you got to start thinking about baby proofing now at this age. You don't have to really start it yet, just start thinking about it. Their next checkup is going to be in 2 months when they are 6 months old, and they're going to get the same vaccines that they've gotten at the 2-month visit. So that's the DTaP, polio, Hib, hepatitis B, PCV, and rotavirus. And it's their 3rd dose of all of those, and it's the last dose of hepatitis B and rotavirus. They will still get further doses of DTaP, polio, Hib, and PCV as they get older, but you don't have to remember that. We will remember it for you. So just remember at their next visit, they'll be getting 2 or 3 shots, depending on the combo vaccines, and 1 oral vaccine. All right, well, thank you so much for listening today. And gosh, I hope you enjoy your 4-month-old baby as much as I enjoy 4 and 5-month-old babies. They are so sweet. Now, make sure you bookmark this podcast and refer back to it because this stuff applies for the next 2 months. And we will see you when your baby is 6 months old. Take care. Thank you for listening to the Baby Manual podcast. Please hit that subscribe button below so you don't miss the new episodes when they come out. I would also love it if you could leave me a review. If you'd like to buy a copy of the Baby Manual, it's on Amazon and Kindle. I'm the author, Dr. Carole Keim, and that's spelled Keim. You can also follow me on YouTube, TikTok, Instagram, or Facebook to get some quick baby tips that will make you feel like an expert. Thanks for listening.